Welcome to another Health Announcement Spotlight series. I'm Jody Tropiano, Health's Head of Content, and I'm pleased to be joined by Dr. Debbie Zimmerman, the Corporate Chief Medical Officer of Lumeris. Thanks for joining us, Debbie.
Thanks for having me.
So 2022 has seen a ton of investment activity in value-based care, and I know Lumeris has been a pioneer in value-based care for decades. So can you give us background on the work that you've done to advance the industry?
Sure. So Lumeris is focused only on value-based care. It has always been our business. We started out over 15 years ago with a Medicare Advantage health plan that was started by physicians. And because it was started by physicians, it was really focused on a better way to care for Medicare beneficiaries. And that is part of our DNA, partnering with providers and providing high quality care, and really in a sustainable way. We've then taken those learnings and we've applied them by working with provider organizations to other populations, whether they be commercial, Medicaid, or Medicare.
Excellent. And I'd also like to congratulate you on another year of 5-star Medicare Advantage plan success. So cheers to that. And if you can just talk a bit more about the CMS Star rating system and the keys to your consistent performance there.
Yeah, so I think, as you know, Medicare produces a star rating annually for Medicare Advantage health plans, and it's on a 5-point scale. You get they're in half-point increments. There are about 40 odd measures each year, and they measure both quality of care, things like, do patients get screened for colorectal cancer or breast cancer? How do you take care of diabetes? And quality of service. Are you answering the phone? Are patients able to be seen in a timely manner? And there's one thing you can count on from CMS, and that is that it changes year over year. This year in particular, for our 2023 star rating, which we just received in October, they actually made a significant change, which is they really doubled down on member experience. And so the impact of that was seen, and many health plans across the country fell. We were actually able to maintain our 5-star from last year. And not only were we able to maintain our 5-star, but when we look at individual metrics, we were able to improve many of them year over year. So how do we do it? Like I said, it is definitely, it requires the full organization as well as our provider partners. And I really can't emphasize enough how much our provider partners contribute to star ratings. So we have a plan. We have governance, we have executive buy-in, we have a comprehensive work plan, hundreds and hundreds of lines long, that gets bigger every year. We have the right data and analytics. We look at performance and try to reduce variation. We look at it by star metric. We look at it by member characteristics, geography, race, ethnicity, gender. Again, looking to identify opportunities and reduce that variation. We look at it by provider group. We look at it by individual providers, as well as things like office locations. So lots of data and analytics that really informs our plan. And then we're willing to adjust our plan over the year. Oh, we're not meeting that goal. We're going to need to change what we do. And then our physician partners really, again, cannot emphasize how important they are. Every one of our physician groups has significant incentives around clinical star metrics. It's a subset of that 40 measures, but really, really important. And we put resources whose job it is to make sure that our provider organizations and our individual locations perform well on those star measures. Clinical operations are just something you have to do and have to do well. Things like paying claims, answering the phones, having a informative member portal, things like that. You just have to do, and you have to do it well. And then we layer on clinical programs, things like reducing readmissions, taking care of our most complex patients, making sure that certain conditions are managed, and all of this comes together in a very, very comprehensive plan. And so it is attention to detail. We have interventions for every measure, and it is, again, being nimble and flexible enough to adjust over time.
And what role do you think patients play in their health? And specifically, how is Lumeris empowering patients?
It's a great question. So, as you know, we have a lot of influence on our own health, and physicians can't do it alone, right? Patients need to be engaged in co-producing their health. So we do a lot of work with our members. First of all, we make sure that their benefits are aligned, and so there aren't as few financial barriers as possible. We also provide additional resources to our most complex patient, whether it be a nurse navigator or a complex case manager. And then we do a lot of engagement. And we do it in conjunction with our providers. They outreach to patients as well, and we coordinate. And we do it in multiple ways. We do it through the use of technology. So as much as possible, can we communicate with people in the way they would like to be communicated with, whether that be text, email, or a phone call. We send letters out, we do newsletters. We have specialized programs around those individuals that may have more complex barriers. So we are continuously reaching out and engaging with our membership to improve their health.
Well, congratulations on your continued success with that again. And so bridging on that, how does Lumeris enable your health system and providers to produce better outcomes for both them and the communities that they serve?
So we work with our provider organizations on, again, every line of business, whether it be Medicare, commercial, or Medicaid. And we really work with them to focus on those things that we know drive performance around value-based care. And the reason we know that is because we study our populations. We try to be very data-driven. And so we look over time, what's the difference between a high-performing group and a group that's performing less well? And that's where we focus. So we focus on things like making sure that the contract with the payer is fair, is aligned, and is at the right level of risk. We make sure that physician compensation is aligned with value-based care and that it's credible and well accepted by those physicians. We work on making sure that we increase the number of lives, right? So that the right amount of attention is given both at the enterprise level and at the physician offices and their practices. I cannot emphasize enough, we talked about it in Star, but having the right data and analytics and having the right leadership and governance that allows people to sit together, look at how they're performing, compare each other's performance, share best practices, hold each other accountable. It's really, really powerful. And then the last thing we do, which is really the heaviest lift, is we really work on care delivery itself. If we don't change the way we care for patients, we're not going to get the outcomes we need. And so we're working on developing programs, whether it be things like complex case management, transitions of care, but we also work with our physicians to enhance access to primary care, to ensure that there's an individual that's caring for somebody across the continuum of care and is really their trusted advisor.
Well said. Thank you again for joining us.
Thank you.